I get a lot of talk about drooling in my clinic. So drooling can happen at lots of different ages and for a lot of different reasons. I think the most common talk about drooling that I hear is at around the 4-month age. So it's really, really common, like maybe 3 months, 4 months, for babies to start drooling a lot. And oftentimes people associate this with teething. And 4 months is relatively early for teething. I never say that it's not teething until I take a look myself, or at least ask, like, do you see any teeth actually starting to pop through, redness, swelling on the gums where the teeth would come through? Because I did once say, oh, it's a little early for teething. And then I went and looked at the kid, and lo and behold, they had 2 teeth. So mom was absolutely right that their child was teething. But if it's just drooling and there's no actual signs of teeth coming in, and it's well before 6 months of age, which is probably the most common time when teething starts, then it's probably drooling for another reason. And the most common reason at about the 4-month point is that babies go through an oral stage. This is a stage of development when, first of all, they're starting to be able to put their hands into the midline. They're finding the middle of their body. They're starting to put their hands in their mouth, suck on their hands. That makes it look like they're teething because they're like gnawing on their hands, or they're wanting to put other things into their mouth and chew on them. That can seem like teething, especially along with drooling, because we do see that with teething too. But really at this age is more of a developmental stage. Actually, I call it the kind of pre-eating stage. It's your baby starting to do things that are getting them prepared for feeding themselves, putting their hands in their mouth. What does this feel like? How hard can I bite on this without it hurting? What are different textures, flavors? What is this, my hand? They're discovering their bodies as well. And that is just a typical time when the drooling happens too. So if that is what's going on with your baby and otherwise they're still doing fine, they're eating fine, they're otherwise really okay, then that's probably what's going on. Now, sometimes babies will also seem like they're a little fussier during that time. This is also a time around 4 months when babies do get very easily distracted while they're eating and, pulling off of a bottle, looking around, pulling off of the breast, looking around. And that could seem like, oh, they're hurting, they don't want to be eating, but it may be more of a distraction sort of thing. So feeding babies around that age, sometimes in a quiet, darker area, can be helpful just to make that feeding go as efficiently as possible. There's nothing wrong with babies taking breaks and coming back, but sometimes it's just more time than a parent wants to spend feeding their baby. So that's just something to be aware of. And then with real teething, sometimes there can be a lot of drooling as well. Some babies just drool more than others. And, just having a bib on all the time and lots of changes of clothes can be helpful. The main question that I think parents want to know is, when do I worry about drooling then? Well, a few things might tip me off to be a little more concerned, or at least want to see your child at some point in the not too distant future. So babies are obligate nose breathers. And like most of us, we breathe through our noses when we're at rest, and we sit naturally with our mouths closed, and we sleep with our mouths closed. If your baby tends to seem to breathe through their mouth regularly, or at rest kind of sits with their mouth open, or sleeps with their mouth open and doesn't seem to be breathing through their nose but through their mouth, then that could indicate that there's something going on in the nose that needs to be checked out. Now, of course, this can happen with a cold, but if this is happening all the time, then it may be something that has to be looked for, because if a baby's got their mouth open all the time, then they're more likely to drool. Also, sometimes babies have low tone in their face, and that leads to an open mouth, and it's not necessarily that they're breathing through their mouth, they just naturally don't close their mouth as much, and that leads to more drool. Again, this is not an emergency, and it may not be a sign of anything really wrong. It's just lower tone, and it may get better over time. But that kind of child, I would probably recommend see a speech therapist to work on the tone. Drinking from a straw cup, I learned, is very helpful in developing those mouth and cheek muscles that can help with facial tone and mouth tone. But it probably is something that should be looked at if you notice that your baby is sitting there at rest with their mouth open a lot. Another thing is if your child is sick and is drooling a lot, and it really seems sick and super fussy and maybe have a fever too, and are really not only drooling, but not drinking much, enough to stay hydrated, or they take a sip because they're thirsty and they spit it out right away. This is the same with older kids and teenagers. That needs to be seen right away, because not being able to swallow even your saliva because of discomfort is definitely a problem. That's an emergency. Those are the big things to look for, to be worried about, and just to be reassured that especially in those younger infants, it could be as early as 2 months that babies start doing a lot of that drooling. And typically it's not teething, but they still may really like those teething rings or things like that to be able to chew on, because again, they're starting to learn what textures and flavors and all sorts of things about their mouth and putting things in their mouth. And that is something that's really important for them to learn. Obviously, you want to childproof your home so that they're not getting anything that's too small that they're going to be able to choke on, especially if you have an older child or toddler around. Want to make sure that there isn't easy access to things that are going to be choking hazards. But otherwise, it is totally, totally normal. So if you have more questions about this topic, feel free to put them in the chat, and I will try to answer things as well as I can. Thanks so much for listening. Have a great day.